I'm about 56 years old, and almost 30 years ago, when I was in my mid to late 20s, I got diagnosed with heart disease. It runs in our family, it's hereditary and genetic, but I had what we thought at that time was probably a mild heart attack, and it was a real wake-up call for me to take seriously heart disease, both in me as well as in our family. My two grandfathers I never met. Both of them died of heart disease before I was even born. So we truly had something to be concerned about for me. My wife and I did as we moved on as a family unit. As you can imagine, in America, it's hard to eat right and to eat healthy. At least it was a lot back then. And over the years, I've had an up and down weight gain and weight loss as I've tried to monitor heart disease and what have you, been on lipids and other things to try to control my cholesterol and what have you. And I just found myself, as I got older, really struggling tremendously with my weight and my eating habits, and it just wasn't working very well. And I was about ready to give up. About a year ago, Todd Hurst, who was a cardiologist that I had met at the Mayo Clinic years before, contacted me, and he shared with me about a new program that he was starting that was going to be working with people like me who had cardiovascular issues to try to deal with them in a much more healthy way through eating and diet and exercise. I was very honest with Dr. Hurst, and I said, I have been on more diet programs than you can imagine. Everything from South Beach to Atkins to Pritikin to, all kinds of diets. I've been on Weight Watchers, and they worked for a while, and then they didn't work very well. And blame it on me. I just wasn't able to sustain it. And Dr. Hurst said to me, he said, I understand that. You're exactly the type of person we work with. Would you please just give it a shot? And I said, well, for you, for me, I will. I will say, I didn't think they could teach me something I didn't already know, but they did. It's much more simpler than any other program I've been on. It's not about calorie counting. It's not even about, weighing myself every day. It was about developing new habits based on much more natural eating, meaning foods that were not as highly processed as even many of the diet foods that I had been eating over the years. And it was much more easy to manage and more sustainable than I had ever imagined. One of the problems I had with dieting over the years is that I was always hungry, and I could never get satiated. Many men and women struggle with that. And under Dr. Hurst's program, it was much more of a natural way of dealing with eating that allowed me to feel much more full and to have a more manageable lifestyle of eating. Within about 6 months, I had lost about 20 to 25 pounds and were much more healthier when it came to my cardiovascular health. In fact, talk about the proof being in the pudding. This last January, my cardiologist at the place I go to now ran the every 4-month blood work because of the medication I'm on, and he actually accused me of substituting a skinny vegan for taking my blood work because he said your diabetic numbers, I'm also diabetic, and your cholesterol were in such normal ranges that he said, if you do this for the rest of your life, I think we can stem the tide of any complications and problems from this. At least for me, it has worked, it's become workable and sustainable, and it has put me on a level playing field that I've been looking for years when it comes to my cardiovascular health, my diabetic health, and I can't tell you how hopeful I finally feel. And I make choices every day to eat healthier, to eat better, and I find it sustainable and workable. Dr. Hurst and his team are wonderful. He's got great coaches, and I could not recommend it strongly enough.